We're using the Act. The Act is very good for things like this. We have millions of masks that we've ordered. They will be here soon. We're having them shipped directly to states. We need certain equipment that the states are unable to get by themselves. So we're invoking it to use the powers of the federal government to help the states get things that they need, like the masks, like the ventilators.
That was a uniquely unclear statement by the president after saying he would only invoke the Defense Production Act. That's what he was talking about in the worst case scenario. As hospitals face essential supply shortages, that act would push U.S. manufacturers to construct medical equipment for hospital distribution and create medical supplies. But one pediatric surgeon fellow tells the New York Times, quote, "The cracks in our medical and financial systems are being splayed open like a gashing wound," while a California surgeon says she has limited access to respirators and basic surgical masks. Quote, "We are at war with no ammo." Joining me now is the epidemiologist and MSNBC science contributor, Dr. Joseph Fair. Joseph, good to see you again, as always. We are getting remarkably conflicting information. And let me just tell you, all the information from people like you, healthcare professionals, public health officials, say the same thing, that there's a shortage of supplies. They're reusing masks in hospitals. Yeah. U.S. San Francisco says they have 200 swabs left. There's an equipment shortage. And then we've got the president saying we don't have a testing shortage and we don't need to invoke this act to get these things made. What's the truth, Joseph?
Well, I think the truth is from the ground, right? And if you're hearing hospitals and frontline workers tell you that, they're not just going to be saying that because, you know, it makes them look good or feel good. They are under like wartime conditions, just like you mentioned, without the tools they need to fight the fight. You know, if you think about if this was a nuclear explosion or a chemical spill, would we take this long to respond to it? No. These are like bombs that go off over a long period of time, and every second we delay in getting the people that are on the front line the tools they need, it's only going to get worse. And then healthcare workers themselves are going to start to get infected themselves without the proper equipment. We cannot afford to lose those people. And right now we're leaving them with nothing to fight the fight.
So we've been discussing for a few weeks this whole idea of flattening the curve, that the same number of people may get infected in the end, but if you can do it over a longer period of time, you never tax the capacity of the healthcare system or exceed the capacity of the healthcare system. And I know when we were talking about this in earlier days, we were literally talking about ICU beds and things like that. But now we're talking about hospital and medical care staff that's laid off, about not having personal protective equipment so that medical workers, frontline workers might get ill, about not having enough test kits and things like that. That's sort of different from the capacity of the healthcare system. We are actually possibly in danger of diminishing the capacity of our healthcare system right now.
Absolutely. We're facing a shortage on every front, not only the needed equipment and supplies, the number of people required to care for these individuals, the institutional capacity itself, just physically. We don't have that set up yet. You know, in California, at least, they, you know, have invoked the law where they can take over hospitals and use those as isolation wards, but we've not yet gotten to that point nationwide. And, you know, it comes back to, it's not just the hospital workers, it's not just the tests. This requires a multilateral effort, and the social distancing is a key part of that. And you can see on beaches from Florida, that's not being done everywhere. Unless we all do it, and we all do it at the same time, in combination with getting those testing and those personal protective equipment out to the healthcare workers, this is just going to keep going and going and going and getting worse. And our economy is going to feel that, in addition, and more importantly, the cost to human life.
Talk to me about what the best solution for that is, because you and others like you have been able to identify with great specificity the things that need to be done, the supplies, the equipment, the uniformity in the approach in terms of shutdowns or social distancing or limiting gatherings. As you said, in Florida, they weren't doing it for a while. I guess I keep coming back to the same idea. If we look at the successes in Singapore, if we look at the successes in Hong Kong and to some degree in Japan, it was about a coordinated response at the national level.
Yes, they had leadership, and leadership that took it seriously because their people were dying. We don't have that right now, and we get conflicting messages between what's happening on the ground versus what you see in a White House briefing. And that leads to, half of the people not taking this seriously because, there are cult-like followers of every White House briefing that, that take every word of that for truth. All you have to do is walk into a hospital like Dr. Badelia's hospital that she was mentioning earlier and where she works to see that that is not the reality on the ground. And so you listen to your troops on the ground if you're in a war, and we're in a wartime situation with this disease.
Ron Klein told me on TV last night, we need to stop listening to those briefings and we need to only listen to medical and public health professionals. Dr. Joseph Fair, we listen very closely to you, and we are indebted to you for continuing to bring us the newest and most up-to-date, reliable information. Dr. Joseph Fair.
Thank you.
U.S. lawmakers are looking to take a good, hard look at how to repair the nation during this crisis, and America's